In 2014, the Ogun State government, under the dynamic leadership of Senator Ibikunle Amosun, launched the Community-Based Health Insurance Scheme (CBHIS), named Araya Project, a primary health care system strengthening scheme spread across 5 local governments in Ogun State, which focuses on maternal and child health. The Araya Project is a non-profit health insurance scheme for cohesive groups of individuals, households and occupation-based groups of the informal sector formed on the basis of the ethics of mutual aid and the collective pooling of health risks in which members take part in its management.
If we go to perhaps the all-important level, the level that takes your health services to the people of the state, and we all know that Senator Ibikunle Amosun is a people person, he's a man of the masses, and one thing that exercised his mind was this issue of access to care. Most people enter the health service coming in through the primary health care level, and the governor was concerned that there are many people out off our radar screen, the people you don't see day to day or when you drive down the roads of a city or a town. Those are people out in the rural areas and the villages. You don't know what is happening to them. They don't come to your health service. They are invisible, if you like. In many cases, they're almost invisible to government. And he wanted us to not only get health services to them, but particularly for groups, as we all know now, the governor wanted free healthcare for children under 5, women and the elderly. At the beginning, he was very keen to start that going immediately. We looked into it, we costed it, and we realized that this is something that wouldn't be sustainable if we are to provide free healthcare for those groups, or even to get healthcare to revolutionize to elevate the primary healthcare services. So we came up with a model of community-based health insurance that will kill 2 birds with 1 stone. It will enable you to take affordable healthcare to the masses, but it will also give you a framework by which government can now enable those groups to have healthcare for free. So how it works is that everybody pays a small, every person who registers. So either yourself or myself will pay 1,000 naira every 3 months. And that will allow you, should you need healthcare services, to access them at any time for free once you have registered and paid.
Now the Araya scheme, which is the ultimate, and that is the health insurance scheme that we put in place. How does it work? All you need to pay, we as state government, I think we will pay 3,000. The insurance outfit themselves. This is a collaboration with some international donors, international organizations, and you all sorts, all of them. We're doing. I think they 4 naira will be responsible for 4,000. The state will be responsible for 3,000, and the individual will be responsible for the balance of the 3,000. If you look at the arithmetic, 3,000 in a year, which means we are talking about maybe 10,000 in a day, because if you do 10 times 30, that's 300. If you do the 300 times 12, that's 3,006. It's even less than 10 naira a day. So for you to have access to health, efficient health care delivery system, I don't think 10 naira is too much. It's not even up to 10 naira. Maybe about between 8 naira or so. If you do the arithmetic to get 3,000 in a year, that's what all you're asking for. Government will subsidize another 3,000, and I think the insurance, the team, there are many people involved. The idea is not everybody will be sick at the same time. So once that is in place, which is in place, we have put our own seed money, the insurance have as well. And I have good news, everybody is running around to register now because they've seen the workability of what we are trying to do. So that is one key area. And don't forget, for the newly born baby, pregnant mothers, and those our elders that are above 70, it's still free completely for them. How do I say it is free? The government now will be subsidizing the 6,000. The insurance will still pay their 4. But for those above 5 years and to 69 years, of course, they will be paying 3,000. The government will be paying 3,000. The insurance will be paying 4,000. So with that scheme, I'm sure we are going to get into that glorious era that health will be not only the efficient, very efficient healthcare delivery system.
In 2013, unwholesome expired drugs worth 1.5 million naira were publicly destroyed in the presence of members of the Pharmaceutical Council of Nigeria and NAFDAC officials. It is of importance to mention the administration's continued efforts in combating the menace of underqualified and fake healthcare practitioners in the state. To this effect, the state has purchased several vehicles for regular inspection of health-related businesses. Such pharmaceutical businesses which have been found wanting or operating illegally have either been sanctioned or closed down, while offenders have been prosecuted. Also, there is an integration of records with Ogun Geographical Information System (GIS) to facilitate identification of premises of these businesses.
The government bought new ambulances. We have rescued, in 1 year, over 3,000 people who would otherwise maybe have not made it to hospital or have made it in very bad shape. We have revamped our drug purchasing. We've even bought a lab for testing our own, for testing drugs that we sample. So if we go around and we do random checks on pharmacies, on hospitals, on hospital pharmacies, on commercial pharmacies, and we can actually test the drugs to make sure we're not getting fake and substandard drugs. And where we identify those, we'll now chase down where it's coming from and make sure we stop that as a source of drugs in the state. So apart from those things that are obvious and out there that people can see, there are many of these other important things. One of the most important things in any health system is a drug procurement and distribution system, and that has been revamped, and we are now more confident in this state. It's going to be very difficult for people to peddle fake or substandard drugs.
Further statewide efforts on promoting the health and well-being of the people of Ogun State is on environmental management, which includes clearing of drainages to ensure free flow of water. This act not only ensures a sanitized environment in the state, but also helps in the Kick Out Malaria campaign and backed on by the state's administration. Furthermore, health workers on the Epidemic Response Team (ERT) are ever at alert to protect the state from outbreak of diseases such as cholera, measles and Lassa fever, which the state has successfully contained in the recent past. Other non-communicable illnesses such as cancer, hypertension and diabetes have also not escaped the closely monitoring eyes of the state's administration. A first-of-its-kind cancer diagnostic and treatment center is being proposed by the state. This state-of-the-art cancer facility will also include health education and community outreaches, cancer prevention program, satellite cancer centers, statewide free screening programs, training of cancer specialist personnel, research of cancer in people of African descent, new drug discovery, tissue bank, and a cancer registry. This facility, upon completion, is expected to be the only such comprehensive kind in West Africa. Other major health programs embarked upon by the Senator Ibikunle Amosun administration include renovation of 100 primary health care centers across the state, renovation and equipping of the Olabisi Onabonjo Teaching Hospital, the expansion of the Ogun State Ambulance Service, as well as a 24-hour call center.
Anybody can turn around and say, yes, well, in my own Adubo, there's this hospital that's not looking good, or I had an experience that could have been better. It's always a work in progress. As I said at the beginning, the health sector has had years of underinvestment, but people shouldn't forget it's massive. We have over 30 secondary facilities. We have the teaching hospital there. We have over 400 primary healthcare centers. We have masses, hundreds and thousands of staff. We have all these other infrastructure to keep going. We have the ambulance service to invest in. So with the little revenue that the government is getting, that has to be spread around, you definitely can't do everything in one day. But nobody can say that, one, the government has not made a massive improvement in the health sector compared to what it was before. And two, it has fulfilled a key promise that he will make healthcare more affordable and more available to the citizens and free to some classes, some specific groups. But the most important thing about the Araya program is we didn't rush it. We've been planning it for over 2.5, nearly 3 years. We did a lot of research, we did a lot of piloting of some of the mechanisms that will be embedded in the program. And we didn't rush it and say, oh, we must start today, and then we roll it out and everybody is queuing and everybody is complaining that this is falling to pieces and this is not working. It will give the government a bad image. So rather, we took our time and got a robust program that is now being rolled out. And even as we speak, like I said, we're coming to the end of the pilot. Why are we running a pilot after 2 years of running? Because we know things can still go wrong, or things may not be foreseen, or that there will still need to be fine-tuning. So we're doing a pilot so that even as we roll out, we're making sure that we get the system really robust, and then when we roll out across the state, it works very smoothly and people don't have cause to complain. So it's better to wait a little longer for a good thing than to have a substandard program fast. But once it is on ground, it will be on ground to stay.
Also, as part of the Ogun State government's efforts to ensure efficient healthcare delivery in the state, free eye surgeries have been carried out, while government has also provided artificial limbs or prosthetics for persons with disabilities.
Even special health workers in various cadres have been employed. In terms of facilities too, not quite long ago, the government partnered with some group, and the government bought quite some equipment that were given to some hospitals, and our hospital benefited a lot from this because a lot of equipment. To get our laboratory, we have quite some equipment. We don't go manual again. We have automated machines that were procured in the past 2-3 years. If we get our X-ray department, we have equipment that are also purchased. Go to the high clinic, my own unit, we have quite some equipment that have been purchased in the recent past, and the services is improving. We also have, like I said, personnel has improved, and our salaries, the personnel are happy working because their salaries are paid regularly as at when due, leave bonuses are paid, so everything is going on. There has been quite some improvement.
Taking a holistic look at all these innumerable achievements of the Senator Ibikunle Amosun-led administration in Ogun State, one can rightly say that his vision of ensuring a healthcare system that delivers competent preventive and curative services through appropriate facilities and well-trained personnel to a health-literate population has so far been achieved in the state.
Like you and I know, once there are innovations, there are improvements in service, nobody will leave quality for non-quality. In recent times, with the innovation that are taking place here, with materials, equipment made available courtesy of the government, the turnout of clients here is on the high side. And don't forget, we also have the manpower. There are nurses here, midwives, doctors, community essential workers, pharmacists, pharmacy technicians, even eye care nurses, mental health practitioners, everybody working in concert. So the service here is quality when it comes to primary care.
A lot of improvement in the routine immunization that are given to the since the administration of Governor Ibikunle Amosun, because right now we have not been recorded any shortage of vaccine. Vaccine is always available at the appropriate temperature. There is no shortage of vaccine, and our people, they receive the vaccine in time.
My name is Francis Bayo Adeleke. I'm representing PCOM in this place. I'm actually collecting money for this Araya program. The prepaid medical service is an arrangement that is made for the people of this state to enjoy. There are a lot of benefits in this program. For children under age 5, they have every benefit to enjoy. From age day 1 to 5, they enjoy everything in terms of health. And for the married one too, they enjoy, when they are pregnant, they enjoy free medical services all round.
My name is Mrs. Oluwatola Oluwakemi. I want to appreciate the tenure of Ibikunle Amosun, our governor. I've been coming to this health center for a while, but when I came in this morning, I saw so many differences. The facility, the equipment provided for, they are all well arranged, and the environment is conducive for us to come here to immunize our children. I pray that God